Want to discuss this a little bit more in terms of whether or not we might even need a national lockdown if more states move to follow the examples set by California and now New York. Joining us is Dr. Rishi Desai. He's a former Center for Disease Control and Prevention Epidemic Intelligence Officer, and he joins us now. Dr. Desai, thank you so much for taking the time to chat with us today. I wanted to start with what we were talking about on yesterday's show, just in terms of the response we're seeing out of the U.S. and how it compares to some other countries. South Korea and the U.S. both had their first case on the same day. The numbers we brought to you yesterday was that country was able to conduct 290,000 tests over its first 7 weeks, while the U.S. was only able to conduct 60,000, not at all close to what we saw over there. The CDC right now has been blaming the FDA for being potentially behind that reason for not getting more tests out there. I'd be curious to get your take on why that happened and how that leaves us in a vulnerable spot now.
Yeah, one other thing that you should also keep in mind is that South Korea's population is 1/6 of our population, right? So we should not match them, but we should be 6 times more than where they're at. And so, this finger pointing between CDC and FDA and maybe WHO, it's not helpful right now, right? So what we need to do is figure out why we didn't respond months ago with the sort of the beginning kind of aggressive testing that we're starting to get behind now. It should have happened months and months ago.
Yeah, I mean, while we're there now, I guess it doesn't matter much. You'd want to have those things fixed moving forward if we do see another pandemic like this. But right now, I had my brother on the show yesterday. He tested positive. We're still waiting results for my parents. They're on day 6 of waiting. And we just think about how little you can do when you don't have the information that you need. They're trying to self-quarantine just to be safe here. But more and more people struggling to get these tests. We're looking at the case count right now, and we're on pace to surpass Italy just on the way that these cases have been growing. So what more can be done at this point if we've already botched the testing phase here in the U.S., and how do we resolve it moving forward?
Yeah, we need to quickly upscale, things like home testing through drive-throughs. These are things that other countries have done, and we can do the same here, and we need to do the same here. We need to do that for 2 reasons. One, you want to flatten the curve, and people have heard that catchphrase, but to recap, what that means is that you want to make sure that as many people who have COVID-19 limit that spread. A lot of people don't have severe symptoms, but have few symptoms, and they're rapidly spreading it. And the quarantines and the shutdowns you talked about in New York and California, that needs to immediately, and I mean today, become federal. We know that this works, and effectively every single country ends up doing that anyway. Mm-hmm. But here's the thing, the longer you take to do it, the longer you have to do it for. And so, yeah, go ahead.
One of the other things too, we've been talking about the doctors on the front lines trying to defend against this as well. The CDC gave an update because there's a shortage of N95 masks in some of these places where you're trying to battle this. Those are the ones that are actually needed. If you are a doctor, they actually fit it to your face properly and make sure that you can't be exposed to the virus, since we're hearing more about how it could be spread airborne. What do you make of that shortage when the CDC is giving updates saying that you could use a bandana at all costs? It just doesn't sound like any of the doctors on the front lines are really trusting the information they're getting right now from the CDC.
Yeah, our healthcare workers, and this is what I mean by raise the line. We really need to make sure our healthcare capacity is at full capacity. One healthcare worker goes down because they're wearing a bandana. What does that mean? They're out for 2 to 4 weeks. Maybe they don't come back because they get sick, really sick. That also means that everyone that they're having lunch with, their significant other who may also be in healthcare, all of their workmates are all quarantined. All of a sudden, your ER is gutted. All of the people are either out quarantined or out sick. So now you've got patients going to hospitals that essentially are not staffed. Basically a hospital without a staff is like an expensive hotel. And so at that point, we're in panic mode because our healthcare is really not doing the job it needs to do. So when you're talking about bandanas and scarves, that's really, really abysmal recommendation, because we know scientifically those things don't work against this pathogen. And putting people at risk is very dangerous and a scary message.
Dr. Desai, Shauna Smith here. I have a question just in terms of the timeline for some of the vaccines and some of the treatments. We heard President Trump and his administration, they're really trying to push the timeline. There's been some pushback from those like you in the medical field who said that you don't want to rush this, that if we rush this, then it could be very risky. On the other side, what is your read on that situation?
Yeah, there are a couple of drugs that are in trials, phase 2, phase 3 trials. There's also some vaccines in early phase trials. I think those two categories are slightly different. When you're giving a medication, even today, we've used some of those medications on a compassionate care basis, meaning that a patient can today receive those medications if they're critically ill and there's really no other option. So that is possible, and I think that that's absolutely fine and warranted. I think getting it through the FDA as quick as possible and as safely as possible is a balancing act. And so I appreciate the concern of like trying to get it through. Also want to make sure that people are clear that we do these things, these trials, to keep people safe from side effects and other things like that that could be equally dangerous. On the vaccine side, this is an international effort. And right now we have a couple of candidates in trials, like I mentioned, some international ones as well. We're likely looking, based on Dr. Fauci's recommendations, at 2021. So really, this whole game is how do we keep ourselves as safe as possible by raising the line, flattening the curve, so that we don't see the terrible outcomes and the ventilator shortages and the ECMO shortages, things like that.
All right, Dr. Desai, bringing us that. Appreciate you taking the time, sir.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.